Welcome to healthU. The miraculous effects of enhanced external counterpulsation therapy for post-stent cardiac patients have finally been scientifically proven. Latest research shows this treatment can dramatically improve blood flow environment and reduce thrombosis risk by up to 18%. When your heart's blood vessels receive stent treatment, the real path to rehabilitation has just begun. Many people think that once a stent is placed, it's a permanent solution. But in reality, changes in the blood flow environment inside the stent directly affect your long-term health. Today, we'll deeply analyze a revolutionary research finding from the 8th Affiliated Hospital of Sun Yat-sen University that may change your understanding of cardiovascular rehabilitation. What is enhanced external counterpulsation therapy? EECP is a completely non-invasive treatment method. Patients simply lie on a treatment bed while medical staff wrap special pneumatic cuffs around your legs and buttocks. These cuffs inflate and deflate according to your heartbeat rhythm. The treatment principle is extremely sophisticated. When your heart is in diastole, or the relaxed state, the cuffs rapidly inflate, squeezing from the legs upward, pushing blood toward the heart and brain, increasing coronary artery blood flow. When the heart contracts, the cuffs immediately deflate, reducing the heart's workload. This process repeats 60 to 100 times per minute, completely synchronized with your heartbeat. Why do post-percutaneous coronary intervention patients particularly need EECP therapy? PCI is percutaneous coronary intervention, commonly known as cardiac catheterization or stent placement. While stents effectively open blocked vessels and restore blood flow, stent implantation changes the physical environment inside blood vessels. The stent surface differs from natural vessel walls, easily causing blood flow turbulence and forming so-called low-wall shear stress areas. In these regions, blood flows slowly, easily creating eddies where platelets and fibrinogen tend to aggregate, increasing thrombosis risk. This is why long-term antiplatelet medications are needed after stent placement. The research team from the 8th Affiliated Hospital of Sun Yat-sen University, led by Dr. Tian Shuai, Dr. Wu Guifu, and Dai Lin Ling from the Department of Cardiology, employed extremely advanced research methods. This study isn't simple clinical observation, but utilizes cutting-edge multi-dimensional 0-1D 3D coupled modeling. What does this mean? Simply put, researchers built an ultra-precise computer simulation system. The 0D model simulates the overall circulatory system status, the 1D model simulates blood flow changes along vessel length, and the 3D model precisely simulates complex blood flow patterns around stents. These three models combined can accurately predict EECP treatment's effects on blood flow environment within stents. The research team collected detailed data from 11 volunteers, including age, height, coronary angiography images, and blood flow velocity data from 5 different arteries during both resting state and EECP treatment. They also innovatively employed the immersed solid method to solve technical challenges in 3D model computation. The research results are exciting. At rest, time-averaged wall shear stress within stents was only 1.39 Pascal, but under EECP treatment at 20 kPa pressure, this value increased to 1.82 Pascal, and at 30 kPa pressure, reached 1.96 Pascal. This improvement is statistically significant with a p-value of 0.0009. What is wall shear stress? It's the friction force blood flow exerts on vessel walls. Appropriate wall shear stress is crucial for vascular endothelial cells, stimulating them to release nitric oxide, a powerful vasodilator and antithrombotic factor. When wall shear stress is too low, endothelial cell function deteriorates, making thrombosis more likely. More importantly is the improvement in relative residence time. At rest, relative residence time was 1.06, decreasing to 0.89 and 0.87 after EECP treatment, with p-value less than 0.001. Shorter relative residence time means blood spends less time in the stent area, reducing thrombosis opportunities. The study also found that dangerous low-wall shear stress high residence time areas were significantly reduced under EECP treatment. This means the most thrombosis-prone dangerous areas within stents were effectively improved. This research has significant clinical implications. First, it provides solid scientific evidence for EECP therapy. While clinical efficacy of EECP was previously observed, specific mechanisms weren't clear. Now we know EECP can fundamentally improve hemodynamic environment within stents. Second, research results help optimize EECP treatment protocols. Different pressure settings produce different effects, allowing doctors to select optimal treatment parameters based on individual patient conditions. 30 kPa per pressure shows better effects than 20 kPa, but whether all patients are suitable for higher pressure requires further study. Third, This research opens new directions for personalized treatment. Through computer simulation, doctors can predict different treatment plan effects for specific patients, developing optimal treatment strategies. EECP therapy has other important advantages. It's completely non-invasive, with no surgical risks. Patients remain conscious during treatment and can even read or listen to music. Treatment typically requires 35 to 40 sessions, 1 hour each, over 7 weeks. Many patients receiving EECP therapy experience not only angina, empedem relief, but also significant overall quality of life improvement. Studies show EECP therapy can improve heart function, increase exercise tolerance, and reduce rehospitalization rates. Of course, EEP therapy has some contraindications. Patients with severe arrhythmias, aortic valve regurgitation, uncontrolled hypertension, pregnancy, lower limb thrombosis, or severe peripheral artery disease are unsuitable for this treatment. From a cost perspective, EECP therapy is relatively economical. While requiring multiple treatments, total costs are far lower than repeat cardiac catheterizations or bypass surgery. Moreover, many countries' medical insurance covers this treatment. This research also points to new directions for future cardiovascular treatment. As computer simulation technology advances, we may soon predict different treatment plan effects before surgery, selecting optimal treatment strategies. EECP therapy development history is also interesting. This technology was initially developed in the 1950s for treating cardiogenic shock, later gradually applied to angina and heart failure treatment. With equipment improvements and treatment protocol optimization, EECP has become an important cardiovascular rehabilitation option. It's worth noting that EECP therapy isn't a panacea and cannot replace medication or lifestyle changes. Healthy diet, regular exercise, smoking cessation, alcohol limitation, blood pressure and blood sugar control. These basic health management practices remain the foundation of cardiovascular health. For patients who have undergone stent treatment, regular follow-up examinations are crucial. Doctors will determine whether EECP therapy or other adjuvant treatments are needed based on your recovery status. Everyone's situation differs, and treatment plans should be personalized. In summary, this research from the 8th Affiliated Hospital of Sun Yat-sen University provides valuable data for deeply understanding EECP therapy mechanisms. It confirms that EECP can significantly improve hemodynamic environment within stents for post-PCI patients, reduce thrombosis risk, and promote cardiovascular health. This represents not only medical technology advancement, but also hope for millions of cardiovascular disease patients. While cardiovascular disease remains a leading global cause of death, every treatment method that can improve patient prognosis has tremendous social value. If you or your family members are receiving cardiovascular treatment, consider discussing EECP therapy possibilities with your doctor. Of course, any treatment decisions should be based on professional medical advice and your specific condition. Health is our most precious wealth, and scientific research continues to provide more and better guarantees for our health. Let's look forward to more breakthrough research contributing to human health endeavors.